We've got some funding from Big Lottery Fund, quite substantial funding, to support development of quality assurance for social prescribing. So I work with colleagues from NHS England, but also Scotland and Northern Ireland and Wales as well. And we're developing a process where there can be a minimum acceptable level of quality, recognising the breadth across social prescribing. So some of the providers are very small, but there still should be some level of quality, often to protect the provider themselves. And so we're doing that because we're a community-focused charity. I'm an exercise physiologist, so I've got interest and experience in that. So we are apolitical, and we've got this function of being provided funding by the Big Lottery Fund, and that will dovetail in to the other processes you see through social prescribing via the social prescribing network. So I think it's important to say that social prescribing has been working for a long time, and we've called it different things. Certainly in the past I've run programs that you might have called social prescribing, but social prescribing as this sort of industrialised scale, as William said earlier, has just started over the last 2 or 3 years. So 2 years ago the social prescribing network started with a handful of people. Now it has more than 2,000 organisations involved, so you can see the scale of it. Later on this year in July we'll be running the first international social prescribing conference with people from around the world. So it's really grabbing the momentum, and I think it's recognising that true healing comes from a caring society, an integrated society, being physically active, being able to help each other. And we've just got to that point where most people recognise that now, so it's become a much more coherent product. Do you know, if you'd asked me how confident I was around social prescribing landing as a mainstream thing 2 years ago, I would have said pretty confident. A lot of people think I'm over-optimistic, but I think just keep going with the optimism. Now I'm going to say 80%. I think the steps that NHS England have taken are really bold steps, brave steps, and I applaud them for that. And colleagues throughout the personalised care agenda have done a wonderful amount of work for us. I think more and more GPs are engaged. The social prescribing network is excellent. The conference that we held at the King's Fund was their biggest conference of the year. Massive support from Big Lottery Fund. So everybody you would expect to see supporting it is supporting it. So this is certainly the best chance we've had and the best chance we'll have. And I am 80% positive that it will land, just because I think if we don't, people know the consequences.